for joining us. Today we're going to be talking with Bill Garr, Executive Director of Lowell House, an organization that serves people who are recovering from addiction. He's going to be able to tell us about what the organization is doing during this pandemic. Thanks for joining us, Bill.
Well, thank you, Wendy, and thank you for having us. It's a little strange having an interview in your house and my house, but we're all sheltering in place. We're all doing good things. But one of the things that we found at Lowell House is our clients cannot be let down. We have to continue serving them, and people in recovery, as you probably know, need consistent support over a long period of time to stay in sobriety, to stay in recovery, and ultimately to take good care of themselves. And so many of our clients have mental health issues, and they're a very vulnerable population. So we did an amazing thing in the beginning of March. We converted our entire outpatient department to all virtual services. So when we left in the second or third week in March, we were ready to serve clients. So as of basically 2 weeks ago, we are currently up and running in our outpatient department. We're running groups and individual treatment. We have our SOAP program, our 6-week day program that's actually running quite well virtually. Thank you, Zoom. That's been amazingly helpful. And we're also doing our behavioral health community partnership with the Lowell Community Health Center, which really helps the most vulnerable clients in our community. We're doing our HOPWA program for people with AIDS, all our case management programs. So we are there for everyone in the community. And quite honestly, after the first week, the numbers began to, hate to use this, but Zoom. And a lot of people have been accessing our services. And people are actually getting a little used to this kind of doing things virtually. So I do want to give people some numbers if they need to access the services. So if you don't mind, I'll give them now. Our main number, if you need an appointment, is 978-459-8656. We actually have a case manager on call from 8 in the morning till about 5 in the afternoon, just for general questions. Where can I find services? Who's open? I have a problem. I need to talk to someone. And that would be 978-866-9145. That's 978-866-9145. Now, the other thing is we had to close our Recovery Cafe. Unfortunately, it was not considered an essential service to stay open. So we closed 2 weeks ago, but we've been open for clients, and Recovery Cafe has had 20 to 30 clients every day. And those are people that are on the street, people that need someone to talk to, people that need not to be lonely. And that's the thing we're battling absolutely the most, is loneliness and isolation. And our coronavirus, COVID-19, is forcing people to be isolated. So our whole Recovery Cafe staff is on the phone every day. They're doing virtual calls like this back and forth, and they are talking to people. You can call Rich, you can call Jamie, or any one of our Recovery Cafe staff. They can't give you a cup of coffee over the phone, although it will try, but they will be able to talk to you about issues on your recovery, issues of how to get through the day and where the resources are. And you can call Rich at 978.
Oh, I was going to say, is that mostly for younger people, or is that for anyone in recovery?
Anyone in recovery over the age of 18. We serve everyone from 18 through 90. So again, let me give you the number, 978-735-3734. And Rich Hollett, our director, that's his number, and he'll be right there for you. So we are very pleased to have that open. And of course, our residential recovery beds, we have nearly 80 beds are full, and all our residential staff, God bless them, they are my heroes. They are working out in the community, and with very little recognition. I mean, we need to give a lot of recognition to our healthcare providers, to our nurses and doctors and first responders. But our residential staff, for very little pay, are there every day, caring for clients in recovery, caring for clients with mental health issues. And so They are in the programs, and so far, so good. So far, we haven't had one active case, but our programs are full. So good job, guys. Keep up the good work. And if you need a residential bed, we are there, including our sober houses, too.
Is there a special number for people to call for those services?
Yeah, use our main number. I'll repeat it again, 978-866-9145. And I want to emphasize what we're really fighting here in this community is the lack of housing for people with substance use and mental health disorders. The shelter is packed full, I understand, and we're trying to help people find housing, to find treatment, to find supports in an environment where everything has closed down. Even the Dunkin' Donuts that they hung around downtown, that's closed. So we have a population that's in some degree of distress right now. And as I mentioned, loneliness. Loneliness is probably the number one factor these days behind addiction disorders, including genetics and other things. But loneliness is equal, according to the Surgeon General, to about 13 cigarettes a day in terms of its lethal behavior. And still, addiction is the number one killer of people under the age of 50. So we're very concerned about the number of relapses, the number of overdoses, and the number of deaths.
Well, it's so great that you're continuing to provide these very, very important services. Do you have any suggestions for how people can think about loneliness?
Well, I think it's very important to do what we're doing today. Of course, it's not the only thing, but I think connecting to people, and I love using FaceTime or Google Meets, free program for most people, or what we're using now, Zoom, and that connects to people. So with our groups, we'll have 16 people in a group. We'll have a therapist, and it gives them a chance to talk with each other, to relate, to feel like they're part of something. I would also recommend that, any place that they currently can be and safely be, like at the shelter, wonderful. That gets them in contact with people. And that's the most important thing. But Wendy, an awful lot of people, and I would say the majority, maybe 80 to 85%, die in their own houses of overdoses. They die in bathrooms, they die in bedrooms. It is the loneliest of all the diseases, and it is the major disease in our country. So I know people are concerned about the coronavirus and COVID-19, but this is a disease that's been with us and continues to kill people. And probably the most vulnerable people in our community are people with substance use and mental health issues.
Very, very true. Is there anything else people should know?
Yeah, again, they should know we're here for them. They should know we don't charge, especially if they have, most of our people have Mass Health. We take Mass Health. If they don't have Mass Health, we have contracts that will back that up. You're not going to pay. You won't be lonely. You'll talk to a very experienced therapist. You can talk to our recovery coaches who are currently active in recovery. And you have people out there that care, that want to help, and we're here for you. All you need is a phone. If you can't get a phone, find a computer, and we're there.
Okay, well, that's a great message. Well, thank you so much. And I hope that people will call these numbers if they need help. So thanks for joining us today, Bill.
Thank you, Wendy, and thanks to LTC so much for all the work you guys do. You are keeping us connected, so thank you.
That's our goal. Thanks so much. Bye-bye.
Bye-bye.